How often do you get asked by patients or by friends, do I have to wear a jersey? Do I have to be on a team? Do I
Right.
to see sports medicine associates?
I love it. As a hip and knee revision and reconstructive and replacement
They
specialist,
probably wonder what you're doing.
I
in the
know
gym.
they come in all the time. They're like, "I didn't know y'all did joint replacements."
Yeah,
And I'm like,
exactly.
"Well, that's about 80% of what I do is joint replacement." So obviously, most of my knee replacement patients are not actually playing contact football. That might surprise you.
Did though. A lot of them did at one point.
It's very true. It's very true. No, I think it's it's an incredible building block for the group that we take care of so many athletes, including professional teams like the Spurs and college teams like Trinity, and y'all have served as team physicians for those teams for so long. That was the basis for the group, but it's certainly not the only people we treat.
Yeah, I can remember in the original meetings, which now 17 years ago when we started the group, we wanted to make a name for sports medicine. And over the years, I've told people, yeah, we love seeing athletes on teams. We see a lot of weekend warriors, and so forth. But really what the devotion is to keeping active people active. And we see all orthopedics. We try to really specialize and make ourselves known in the sports medicine world as physicians, as surgeons. And what that really translates to in English is keeping you active, helping you do the things you want to do. If you're on a team, it's important to be playing and be practicing. That's why you're on a team, or your parents pay for you to be on a select team or whatever. As a parent, I always wanted to see my kids play for their high school. So when they were missing due to injury, it's kind of a bummer.
Oh yeah.
You want them to do well, but it's kind of a letdown on another level. But if we could keep people active, they're more self-sufficient.
Yep.
They can care for themselves. They're bound to be more active playing sports. And so we pride ourselves on being sports medicine associates, taking care of all the teams and schools we have over the years. But really what we work on is our service and our devotion to patients and getting them better. Without much dysfunction, without much downtime.
I always explain it to patients. I was like, being sports medicine, I think, has helped the group really pioneer the idea of we're trying to get you back fast, whether it's to football or whether it's just to work or daily activities or recreation. I think the mentality is the same. Our goal is not to, say, hey, doc, I've got this problem. Oh, well, if you're, somebody who likes to work out, just don't work out anymore. It's not the right answer, right? Like the goal is for quality of life. And I think that's true whether it's return to play, where our group excels because we have the relationships with trainers and coaches and we really know the schools and the athletes. But then from an adult perspective, I don't approach my discussion with the patient about all the things I'm going to tell you after your joint replacement you can't do, because that's not fair. If we're doing that, why even bother doing the surgery?
Right.
So I think that the sports medicine approach has really helped elevate our approach to patient care. And it's a huge portion still of our practice, even though they're not the only patients we treat.
And I think patients over the years, another comment I get regularly is they're very appreciative of that approach.